Understanding lung anatomy and lung cancer. Have you ever wondered how the structure of our lungs plays a role in lung cancer? The lungs are two sponge-like organs located in the chest, and they are vital for breathing and gas exchange. Each lung is divided into sections called lobes. The right lung has 3 lobes, while the left lung has 2 lobes, which are smaller because the heart takes up some space on that side. Air enters the lungs through the trachea, also known as the windpipe. This tube branches into 2 main tubes called bronchi, with one leading to each lung. These bronchi further divide into smaller branches called bronchioles, which end in tiny air sacs known as alveoli. The alveoli are crucial because this is where oxygen from the air enters the blood, and carbon dioxide is removed during exhalation. Surrounding the lungs is a thin protective lining called the pleura, which allows smooth movement as we breathe. Below the lungs, the diaphragm muscle plays a key role by moving up and down to help us inhale and exhale. Now, when we talk about lung cancer, understanding this anatomy becomes very important. Lung cancer usually starts in the cells lining parts of the respiratory tract. Most lung cancers begin in the epithelial cells of the bronchi or bronchioles, but they can also develop in the alveoli. There are 2 main types of lung cancer based on the cells involved: non-small cell lung cancer and small cell lung cancer. Non-small cell lung cancer often arises from mutations in the bronchial epithelial cells and includes subtypes like adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Small cell lung cancer is typically more aggressive and originates in the central airways. The structure of the lungs influences how lung cancer develops and spreads. Tumors can grow within the lung tissue or in the bronchi, which can block airways and make it hard to breathe. Cancer cells may also invade nearby lymph nodes in the central chest area between the lungs and can spread to other organs. The pleura can be affected too, leading to a condition called pleural effusion, where fluid builds up and can cause shortness of breath. From a lung health perspective, knowing about lung anatomy helps us understand symptoms of lung cancer, such as a persistent cough, chest pain, and difficulty breathing. These symptoms often relate to the tumor's location and size. This knowledge also guides doctors during diagnostic procedures like bronchoscopy, where they visualize the airways, and imaging scans. It helps in planning treatments, including surgery, radiation, or targeted therapies aimed at specific tumor types and locations within the lung. In summary, the anatomy of the lungs, which includes the trachea, bronchi, bronchioles, alveoli, pleura, and diaphragm, provides the framework where lung cancer can originate and progress. Understanding this anatomy is essential for diagnosing, managing, and treating lung cancer while highlighting the importance of maintaining lung health to reduce risk and support respiratory function. Always remember to consult healthcare professionals for personalized advice regarding lung health and cancer.